in a domestic violence situation. I came to the Bronx because it was a safe borough for me.
We were victims of a house fire, and so we went to go live in the shelter on Fox Street.
I had 3 children that I had to safeguard and myself.
When we moved into the shelter, Alyssa was 4 years old, Alexandria was 9 years old, and Louis Jr. was 10 days old.
About a month and a half after we've settled into the shelter system, it seemed to me that my son had been showing signs and symptoms of decompensating and emotionally breaking down.
And anytime they smelled smoke, it was horrible. They'd start crying and say, "Not again."
I believed that my children needed psychiatric care.
Study after study has shown that homeless folks, compared to the regular population, have higher rates of chronic disease, they have higher rates of mental health conditions, and that they have lower access to health care than the general population.
Hi, Dr. Scott. Hi, Faith. How are you?
Good.
Good.
When we
You're
see
here for
these
your checkup?
children, they haven't had consistent medical care. We actually provide that care for them. We become their medical home. A medical home
Panda Bear.
where they're able
gonna
to
listen to your
get addressed, not just their medical issues,
Good.
but
And then
their
he's gonna listen to
psychosocial issues as well.
You're breathing. Can you take a big breath for me?
It was a place where the children felt safe. They knew the people that were working with them.
What about your nose? Are you having any runny nose?
Yeah, I'm
Yeah.
just having things with my nose.
What's going on with your nose?
Well, all the naughty things are inside my nose.
What does the things look like in your nose?
They look like round things.
Like round things?
Yeah.
Wendy Quinones. Very warm, very welcoming, very concerned, very smart. And they know her, and they felt safe with her.
It's an incredible feeling to see that you have actually made a difference in the life of that child for a very long time, because now they'll be able to start school, they'll be able to integrate with their peers, and hopefully be successful adults.
And so when the Children's Health Project comes out and brings out a van and says, hey, we'll fix your teeth, or let's check on your nutrition and diet, or let's see how the kids are doing and make sure that they get a physical. And, you want to turn around and say, who's behind you and who's doing this, and, look up and say, God, is that you,
The mobile medical units are a cornerstone of our program. We're able to extend our reach. So our main clinic is here in the South Bronx, but with the mobile medical units, we can send a medical team out to Manhattan, to Queens, to Brooklyn, and typically we go to a large family shelter where there's a lot of families who need care, and we stay there for the entire day, and we deliver healthcare to many families. We go there week after week, and they come to know us, we get to know them, and we're the providers for that shelter.
I really have grown fond of the clinic and everybody there. They know me and I know them, and it's much more comfortable speaking when you are familiar with the people that you're speaking to.
The work we do would not be possible without the grant support that we receive. So we are grateful to all the people who donate to us and who actually provide the funds to allow us to continue working.
As a professional woman, as a mother, I see the difference that we make every single day in the life of these children.
The Children's Health Project has been an enormous factor in our mental and healthy well-being for me and my children.